Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers. I'm going to be your facilitator for today's session. Today we have with us Lucy Barylak and Dr. Elliot Montgomery Sklar. This is the first in their series of how to include caregivers in the care team. And today they're going to be talking about defining caregivers and recognizing their experiences. So let me tell you just a little bit about them before they get started. Dr. Elliot Montgomery Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare science at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term care manager of the Caregiver Support Center at a respite program for family caregivers. She oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. She has been a key architect of screening and assessment tools of family caregivers, for which she provides training to healthcare professionals across North America. Lucy consults for private industry, including WellMed Charitable Foundation and clinics in Texas. Additionally, Lucy is a liaison supervisor of the School of Social Work at McGill University, where she currently supervises, I have 20 interns, that may be plus or minus. And she also wants you to know that she was a caregiver for her mother. Lucy and Elliot, welcome to the session today.
Thank you so much. Welcome, everyone. And thank you, Glenda, as well, for mentioning that this is part one of a three-part series. We're really excited about it, and we certainly hope that you'll join us for this week's and our other two sessions. Our program next week is focused on handling difficult situations, including elder abuse. And our third program in this series, the last week of this month, addresses diversity in caregiving and how important that can be. So welcome everyone once again. So today we're going to be talking about recognizing caregivers' experiences and also discussing who caregivers are. We have some learning objectives. So we want, because it is kind of an educational program and Lucy and I are both educators, we wanted to structure it so that you know what to expect from today's program. We're going to describe family caregivers and their challenges. We'll discuss the role of family caregivers in care planning. We'll review physical and mental health issues among caregivers, and we're going to discuss addiction as well. Finally, we'll identify resources and support services for caregivers, which are so important.
Thank you, Elliot. Welcome, everybody. So glad that you're with us. You know, frontline healthcare workers are the backbone of effective healthcare system. They're often based in community and come from the community they serve. They play a big role in providing services, solutions, referrals, and prevention to families, individuals, caregivers, and care receivers. We know, however, that the role of the healthcare worker is focused on patient care and patient-centered outcomes. And we also know that there's a tremendous shortage of staff in different facilities. There are more caregivers than ever before, and their role in supporting the health of our most vulnerable is crucial, not just to the person for whom they are providing care, but in supporting our healthcare system as a whole. This is why we have created these series to support healthcare workers understand the role of caregivers and recognize the difficulties that caregivers face on a daily basis that could very well affect their well-being both physically and mentally.
Sorry, my computer is sticking. There we go. Whoop, there we go. So, caregiving in the US is a national study that's coordinated by the National Alliance for Caregiving and the AARP. It's the actual only data that's routinely collected about caregivers in their role in the US. And the 2020 study is the newest data that we have. Although we really both feel like COVID has changed things, which is not reflected in the data. For example, we know that a lot of seniors, the most vulnerable of whom in nursing homes died, which may certainly have an impact on the number of caregivers out there now. Other people have long-term complications as a result of COVID requiring caregivers too. And finally, staffing shortages since the pandemic have been a persistent issue in nursing homes. So that's been resulting in longer wait times. And thus, many caregivers also report a lot more stress since the pandemic because they're less comfortable with the idea of placing a loved one in a long-term care facility. Nevertheless, this report increased the number of caregivers ahead of the pandemic had increased to 9.5 million from 2015. I'm sorry, by 9.5 million rather, from 2015 to 2020. Family caregivers now encompass actually more than 1 in 5 Americans, and they have unique complications linked to their role. So, some key findings of the report indicate that the majority of caregivers are baby boomers, but we know that this trend is changing and many younger adults are becoming caregivers. 61% of caregivers roughly are women, 39% are men, and we know that the financial inequities for caregivers are certainly present. 61 of them work, and 45% have had at least one financial impact as a result of their caregiving role. So, for example, that might include being passed up on a promotion at work, needing to take time off, or actually not even applying for that promotion because of the other responsibilities on your plate. So, more than a quarter of family caregivers report that they have difficulty in coordinating care. I know firsthand in South Florida just how challenging that can be from my own experiences with colleagues, friends, working with community organizations. We also know that there are inequities among diverse caregiver populations, something that we'll really talk about during our last program in this series, and even between men and women, something we'll focus again upon in our last session. So, to give you some idea of how the health of caregivers is impacted by their caregiving role, about 1 in 10, 11% of caregivers in total, report that caregiving had caused their physical health to get worse. Caregivers also reported chronic conditions like heart attack, heart disease, cancer, diabetes, and arthritis at nearly twice the rate of their non-caregiver peers. So, same age groups. Women providing care to an ill or disabled spouse are more likely to report a personal history of high blood pressure, diabetes, and high levels of cholesterol. Women who spend 9 or more hours a week caring for an ill or disabled spouse increase their risk of heart disease twofold. And nearly three-quarters, so 72%, of caregivers reported that they had not gone to the doctor as often as they should. More than half, 55%, had missed doctor appointments. So, why are these statistics and information important for healthcare workers? In our opinion, they present a concern for healthcare workers because if our healthcare workers are reliant upon informal or family caregivers to participate in the delivery of healthcare, what happens if they're sick? Now, healthcare focuses mainly on patient-centered outcomes, but do healthcare workers have an obligation to also support the well-being of caregivers? This is something we're really going to talk a lot about over the course of this series. There is some newer data that has recently come out because we're in a voting time, and we know that all of these political things also collect a lot of data. What's been interesting is some data that was collected last spring as part of the US voters' views on support for family caregiving. And it's a bipartisan report. What's encouraging to see are that so many issues are being addressed on a political and social landscape right now in the realm of caregiving. And in addition, The issues of caregiving are important and consistent with the Caregiving in the US 2020 report. Also, from what we hear and know from healthcare workers and caregivers who speak of their own experiences. Family caregiving is a common experience now in the US. About a third of registered voters say that they have been a caregiver in the past. 1/5, so about 21%, same, and are currently caregivers, and about half expect that they will become caregivers. Also, time and money are the top challenges for family caregivers. When asked to identify their biggest fears, the answer was overwhelming about time and caregiving. Work-life balance is also very elusive for family caregivers. We know this. Common among caregivers is the experience of emotional stress, having to miss an important event, and also needing to balance work, family, and caregiving responsibilities. So these are very important. So I think we should think about, how does healthcare view the role of caregivers? Lucy, you're muted.
Sorry about that. Thank you, Elliot. So what I want to talk about today is how healthcare workers perceive caregivers. And I'm going to talk about a research project that we did, and it was extremely interesting because do we see them as a resource? Do we see them as a partner? Or do we see them as a client? So what I want to say, it has been largely demonstrated through research and working in the field that without the support of family and friends, majority are mainly women, it would be impossible to maintain people with major disabilities in the community. We know that family caregivers pay an important price at all levels for their involvement in providing care. We know that caregiving can be rewarding. However, for many, it does take a toll on them on a daily basis. Now, if we look at most models of care and service delivery regarding caregivers as a resource for maintaining frail elderly or those with any form of dementia at home, some healthcare providers feel that caregivers should be performing these duties. As well, many perceive that it's the family's duties to provide care. There's also an expectation at times to develop skills and knowledge in nursing for caregivers, rehabilitation treatment, and equipment maintenance. Many caregivers themselves don't see themselves as caregivers, but only as a wife, a husband, a partner, a child, etc. So in order to support and make sure that caregivers care for themselves, healthcare workers are the key in providing, identifying, and advocating for caregivers' rights. Caregivers need to maintain their own well-being in order to care for their loved ones. So let's go back to the research that I was talking about. We did a study. We looked at multidisciplinary people working in the healthcare system to see how did they perceive the role of a caregiver. So we asked them these questions. So the questions are caregivers a resource? And a resource provides the right information, support at the right time. We also asked them, do you see caregivers as a partner? And partnerships is an arrangement where parties agree to cooperate and advance their mutual interests, being equal in decision-making. And then we also asked, do you see caregivers as potential clients? So the result was really very interesting because most healthcare workers really did see caregivers as a result because they really were counting on them to do most of the work. So the question, is it right to expect caregivers to be a resource in certain circumstances? And if the caregiver is able and willing to perform certain daily tasks, then yes. However, when the caregiver cannot, because of their own limitations, their age, or just unwillingness, then whose responsibility is it? I think that we all need to look into our own value system, our own cultural background to answer these questions for ourselves. For example, do we expect a daughter who is capable to perform certain nursing tasks for her mother, like learning how to give insulin shots? So at this point, I'd like to share my own experience when I was a caregiver of what happened to me, and maybe that would relate something to you as well. So at one point, my mother had many different issues, but she developed she developed diabetes, and she needed to have insulin shots. I received a call from the nurse, a very nice person who really cared for my mom, and she said, "I'd like to meet with you at your mom's house." I said, okay. At the time I was working, I still had kids at home, and I had many things on my plate. And when I did come, her first reaction was, okay, I'm so glad you're here. I'm going to train you how to give insulin shots to your mother. And I froze. I am petrified of needles, and the idea of giving my mother an insulin shot frightened me to no end. And the first reaction that came out of my mouth was no. I saw the disappointment on her face, and I saw that I was being judged. So, I mean, this experience really taught me a lesson. It was like, we really have to be so careful of how we approach things and to first ask the right questions. So having said all that, I would like to ask you a question. What are your thoughts about caregivers as a resource? Do you expect too much from the people that you're caring for, from the caregivers? Let's open it up for a discussion.
You can unmute your microphone, raise your hand if you're on Zoom. If you called in, you can press *6 and that will unmute your telephone so that we can hear you. We'd love to have you join the conversation.
You know, it's not an easy question to answer, and I don't know if any of you have ever thought about it, you know. It's just something that is just in many cases expected, not only from the healthcare system, but from caregivers themselves. As I said, they feel that they're family, so obviously they should be there. But if, you know, think about it, I mean, because it's important to keep that in mind. What are your thoughts about that? And how do you deal with caregivers when they are doing too much, or they're not willing to be caregivers at that particular time? I see something there popped up.
Yes, absolutely. This is from Deborah. My husband, who requires 24/7 care, expects me to care for him. Expectations are an issue.
That's on an individual basis. Yes, I can very well understand that that's difficult, that the expectations are so great. And, you know, we can go into a long discussion about that, but I think it's so important for caregivers to learn how to set boundaries. And if you do have a social worker or a healthcare worker that you're working with to help you identify the tasks that you can do and the tasks that are too difficult to do. Thank you for that. Okay, so let's move on to the next slide. All right, so the question can be, you know, what about partnership? Do we see our caregivers as a partner? If so, what does partnership mean? I think we need to look at that, because being equal in decision making, the important thing to keep in mind is that the caregiver knows that their loved one better than anyone else, but they also know their limitations. It's important in a partnership to ask what the person needs or what they feel they can do and manage. You know, negotiation is the key factor in any partnership relationship. So as I'm talking about, are they a resource and are they a partner? So if they are a partner, many times I would ask myself and my team, you know, for example, are caregivers included in care when you are developing a care plan? Are caregivers included when you have meetings, when you're discussing the case conferences. So it's really important to be able to negotiate. Can anyone give us an example of how to negotiate with a caregiver and providing care for their loved one? It's a big question. Well, negotiation is part of the work that we do with healthcare workers. Negotiating, meaning that there's two people in this relationship. One does not outweigh the other. So when we are developing a plan of intervention for the patient, it's really important to make sure that the caregiver is able to perform some of these tasks and to be able to negotiate and see how much they're willing and how much they're able to do. If we go to the next slide, we're looking at our caregivers' potential clients. If yes, why? So again, I'm asking the same question. Do you think that caregivers could be potential clients? I see something in the chat.
You have a couple of things there, Lucy. Jessica said that her mother is a retired nurse practitioner and her spouse has dementia. And she believes that all the medical providers involved assume that because she knows how to provide complex care, that she should. Another expectations thing.
Yeah, that is really, really a good example of what happens. I mean, it's because you're in the healthcare system, it just assumed, and that's why it's so important as healthcare providers to look at ourselves and what are the expectations you have of caregivers and to be very aware about it. That's why we sort of categorized it as a resource, as a partner, and as a client. So I hope that your mother stands up for herself and really is able to negotiate and say, yes, even though I was a nurse, but some things I can no longer be able to do.
Exactly. And Deborah also says, sounds like a success to me. She was fortunate for a time to have home health care, and the nurse and she formed a partnership on how to care for her husband. That's pretty ideal, I think.
No, that is a very good, somebody was doing their job, I have to say. So that's a very positive, and that's what should really be going on in the reality. When you're a healthcare worker, the negotiation with the caregiver to recognize their needs, their limitations, and to be able to work together as a partner in providing the care for the care receiver, at the same time respecting the needs of the caregiver and what they can and cannot do. And many times as a healthcare worker, you almost sometimes have to give caregivers permission to say, I cannot do it, and help negotiate and provide them with the support that they need. And that can go as far as when it might be too difficult to maintain the person in the community at home, and to be able to give permission to the caregiver and say, maybe it's time to look for additional relocation or additional services.
And it looks like Michael had a different kind of experience. He said, I was not paying 16K. Is that 16,000?
Yeah.
A month for me to take care of my wife in her facility, but that did not motivate the caregivers to do my job willingly. They have been told to use me, but as an employee, not a resource, a partner, or even as a client.
And I was going to comment on that and say, actually, when you think about it, what do we call employees when we deal with them? They go through human resources, right? So resources are, in a sense, the employee in that dynamic.
Well, this was a perfect example. Thank you for that. I mean, you brought it all together of what, as a healthcare worker, how we should really be focused more and take a look at what is the scenario here? What is the family going through? Thank you for sharing that. All right, so maybe we can move forward. Since we know that caregivers are at risk for burnout, depression, and possible developing physical and cognitive issues, we need to be mindful that they may need a help as well. Being a client means that they hopefully will receive support, possibly services when needed, and the expectations that are associated with caregiving, will be somewhat diminished for them. As a client, they also are given permission to care for themselves. This is very important. Sometimes we don't realize that a caregiver may need as much support as the person that they're caring for. And so if you're concerned about the health of a caregiver, provide a referral, even to a local community health center. 211-988 can be great resources for some health professionals. They are now bill-able codes for caregiver education and other intervention. Caregiver education can have a positive impact on empowering the caregiver, especially when they are expected to perform healthcare functions.
Yes, absolutely. And I think that key about the billable codes is very important for healthcare workers to know and to also ask within your organization how to proceed with that, because it can be very important. Now, understanding certainly there are limitations. If you are concerned about the health of a caregiver, please certainly speak with them, take a moment, tell them to go see their doctor, provide a referral if you can. As Lucy said, I think this is so important. And self-care among caregivers becomes all the more critical too. It's something we need to all practice more of, including healthcare workers. Now, it's something that I know we often don't practice what we preach. And we hear self-care as a buzz term a lot these days. But I think for healthcare workers uniquely, there's a reason we're in the helping professions, right? So when we embark upon those careers, our focus is upon caring for others. And I think in the process, sometimes we lose sight of the fact that we need to care for ourselves too. Researchers know a lot about the toll that caregiving takes on the health of caregivers and also the stress that it puts upon healthcare workers too. So when you're working with family caregivers, ask them, how are you feeling today? And a question that I love because it always stumps people, what do you need today to feel taken care of? I think it's something that we all should ask ourselves. I try to make a habit of doing this routinely because it reminds me of the importance of self-care and what I tangibly need to do that day for myself, which is usually going to the gym. But I think it's important for healthcare workers to practice the same thing, to ask ourselves, what do I need to feel taken care of today? I find that the helping fields are such rewarding career professions, but we also need to sort of acknowledge the demands that are inherent with the job of being a healthcare worker. And so I hope that each of you take some pause and ask yourselves, what do you need to feel taken care of?
The psychological health of family caregivers is negatively affected by providing care. Higher levels of stress, anxiety, depression, and other mental health effects are common among family members who care for an older relative or friend. So, caregivers show higher levels of depression. Studies consistently report higher levels of depressive symptoms and mental health problems among caregivers than among their non-caregiving peers. Estimates shows that between 40 to 70% of caregivers have clinically significant symptoms of depression, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for major depression. Both caregiver depression and perceived burden increases as the care receiver functional status decline. Thus, higher levels of clinical depression are attributed to people caring for individuals with dementia. Studies show that 30 to 40% of dementia caregivers suffer from depression and emotional stress. Depression and anxiety disorders found in caregivers persist and can even worsen after the placement of the patient in a nursing home. Many caregivers who institutionalize their relatives report depressive symptoms and anxiety to be as high as it was when care was in the home. And that's really very interesting. Depressed caregivers are more likely to have coexisting anxiety disorders, substance abuse, or dependence and chronic disease. Depression is also one of the most common conditions associated with suicide attempts. I also want to say that caregivers suffer from high levels of stress and frustration. Caregiving have higher levels of stress than non-caregivers. They also describe feeling frustrated, angry, drained, guilty, or helpless as a result of providing care. Some 16% of caregivers feel emotionally strained, and 26% say taking care of a care recipient is hard on them emotionally. An additional 13% of caregivers feel frustrated with the lack of progress made with the care recipient. Caregiving can also result in feeling a loss of self-identity, lower levels of self-esteem, constant worry, or feeling of uncertainty. Caregivers have less self-acceptance and feel less effective and less in control of their lives than non-caregivers. More than 1/5, 22% of caregivers are exhausted when they go to bed at night. They feel they cannot handle all their caregiving responsibilities. It's important to keep these things in mind because healthcare workers can sometimes be the outlet for caregiver stress and frustration. Sometimes a healthcare worker is one of the few people that a caregiver interacts with. It can be helpful to acknowledge caregiver stress and frustration and also your professional boundaries in remembering that you are there in a healthy capacity and that they are not alone. A simple question, as Elliot said, he was talking about, and how are you feeling? I'm concerned about you. Okay, I do want to talk a little bit about caregiving and addiction. Caregivers may, many times may turn to alcohol or medication to help them manage with stress, both physically, emotionally, and many become addicted, even to sleeping pills at night or even over-the-counter medication. So I do want to talk a little bit about addiction and with caregivers. It's among the fastest growing health problem in the United States. The prevalence of substance use disorders remain high in baby boomer generation as they age into later life, including substances such as alcohol, tobacco, cannabis, prescription medication, especially painkillers, shopping addiction, gambling, cyber addiction, and sometimes even binge eating, sex, and others. So caregivers may be at risk for addiction, substance abuse, and behaviors. So I think it's really, really important for healthcare workers to be very aware of that. In the past, people often spoke about addiction as a lack of willpower, as a selfish act, as an expression of weakness. This is not the case. Addiction is a disease that over time can physically change a person's brain, the way they behave and act, and even aspects of their personality. This disease can have both physical and major psychological repercussions. The disease of addictions may be treated like you would treat a diabetes or any other illness and involves a treatment plan and good support system. So I think it's important for us healthcare workers to just be very aware of that. So let's look at some of the signs of addiction. Lack of control, decreased socialization, withdrawal, binging, distant change in sleeping. They're sleeping too much or too little, chronic fatigue, constant illness, injuries, physical changes. Their skin can be bad, the hair, teeth, nails, at times even memory loss, depression, aggressive behavior, apathy, and more. So I was just wondering if anybody would like to ask questions about this. Did you ever think of the fact that caregivers can become addicted and have addictive behavior?
Just a reminder, you can unmute your microphone if you're on Zoom or raise your hand. If you called in on your telephone, you can press *6 and that will unmute your phone so that we can hear you.
While people think about it, I had the opportunity actually to attend a conference, a virtual conference 2 weeks ago about caregivers and substance use and the pandemic. There's a lot of research that looks at caregivers of children and the increase of use of tobacco actually during the pandemic, but certainly alcohol, and how that changed dynamics in people's homes. The research was quantitative, so looking at the prevalence of use of alcohol and tobacco and other things. But it was also qualitative interviews with families about their experiences, interviews with care recipients, with children. There is an increasing number of research now coming out about caregivers of older adults, but the research is much less, because I think the focus during that time was looking at the stress upon caregivers who may have had loved ones in long-term care or were concerned about risk of COVID infection in the home as well. But these are things that led to people's use of substances a lot more. Something else that is interesting, I find, among older caregivers, if, for example, you're an older caregiver caring for a spouse or for a parent, there is also another form of behavior called orthorexia, which is an increased focus on eating healthfully and making sure that you eat foods that have few additives, whole foods, weighing your foods, counting calories, measuring things. And the reason being is that this is one of few things that caregivers can control in their caregiving experience, because we know that so often a lot of what happens in the caregiving journey is beyond our control. What we can control is how we cope with things, how we deal with things. And for many people, it's by controlling certain things that they can. So it's such an interesting area of research. And Lucy, I'm very thankful that you always bring this into our discussion, because it is very important to consider that caregivers are vulnerable to this, just as we all are.
Well, it's definitely a trend that we see a lot more research being done on that. And many times it's the healthcare worker that really is able to identify that. Sometimes it looks like the person is extremely depressed because some of the symptoms are very similar. If you look at that, memory loss, withdrawal, things like that, not sleeping, not eating. But to be able to ask the right questions, to be able to find out what medications you are taking, how are you dealing with your stress? How are you dealing with being overwhelmed? It's not an easy subject to talk about, but it's such an important subject to be aware of, because in the reality, because the symptoms are so similar to other conditions that people go through, especially emotional things, then it's kind of taken for granted many times. But if the person is able to feel confident in you and trust in you and be able to say, yes, I've been drinking too much. So asking that question is important, but how you ask it is also in a very sensitive manner. And I think it's important to be able to practice that and see that it doesn't come across as if you're pointing the finger at someone. All these things take a lot of effort and a lot of time. And I think it's so important to be able to discuss with colleagues, talk about it with your audit colleagues and ask them, do you notice a change in things I've noticed some of my clients' behavior. Would we deal with that? And so if I go back to the original, why did I speak about how do we see caregivers? Because it's important to really recognize that maybe our expectations are too high of them as well. And how can we? So remember the balancing act. There's two people in this relationship. One does not outweigh the other. Just because somebody needs more physical care or maybe more medical care, which is the care receiver, does not mean that the other person who's caring does not have all those issues as well, and possibly needs to be a client.
And Lucy, you brought up the issue of expectation, which loops back to the first chats that we had at the beginning of our program today. And I think it's a good loop, actually, because as a society, I think we do expect too much of unpaid or family caregivers. It's something we talk about all the time. Healthcare workers are fortunate to receive training to provide the services, the skills, the treatments that they do. Family caregivers, unpaid, informal caregivers, don't receive that same training, but yet our social expectation is that they will fulfill a role. You know that the source of long-term care, the largest source of long-term care in the United States, comes from informal and family caregivers. So that puts a tremendous strain. And I think you also raised another very, very good point about the role of communication and gaining trust, which is something we're going to discuss during every one of our programs in this series because they're so critical. And certainly how you approach a discussion about concern for a caregiver's mental health or physical health requires a lot of tact and training too. And we don't do enough training for healthcare workers about how to communicate about difficult things. That's why difficult situations come up, which is actually one of our focus areas for our program next week. But ahead of concluding our program for today, I think let's see again if anyone has any comments, questions, or any experiences that they would like to share. And then we will share some resources.
Jessica wanted to comment, and a good point, I think. We talk about compassion fatigue as professionals, but I don't think we talk enough about it with unpaid caregivers.
Amen to that.
Yeah.
Absolutely. And that's why that question, what do you need to feel taken care of today, is a question that no one asks. We never ask it of ourselves. We never ask it of others. And so every time that I've asked it in my classes when I teach students, because we know that a lot of students are caregivers too, no one ever has an answer. And you know, I said earlier that we use self-care as a buzz term a lot in our society. But when you actually ask people what it is that they're doing to care for themselves on a given day, most people don't have an answer. So it's important that we take some time and think about that. And Deborah just said, the problem is this going to end? Uncertain. What is going to happen? Am I doing enough to keep him alive? Yes. These are a lot of things that caregivers grapple with and feel guilt about too. There's a lot of range of emotions that go with all of the statements that you just entered into that chat.
And as a healthcare worker, you know, it's our antenna should go up, you know, by asking the right questions and by body language that a caregiver presents. The reason that we ask so many questions about history is we want to get a good sense of what was the relationship like before. And just to throw another something into the pot, many times we just assume that if you're caregiving, you absolutely love the person you're caring for. But that's not the reality many times, you know, and it's important for healthcare workers to understand and try and figure out what was the relationship like. Maybe it wasn't a good relationship, and the person is finding that they're in a position that they're caring for that person. Could be a relationship, a marriage that was really, really bad, and here you are caring for that individual. And you could just imagine all the feelings that that person might go through. So as healthcare workers, we have such a responsibility to look at the two people, to really have a really good understanding of what the caregiver, what their relationship was like and what they're going through at this time.
Any other comments or questions before we move forward?
You'll see in the chat box, if you're on Zoom, that Minerva has put links to the next two sessions in this series. So you can click on those to register and get more information.
She beat me to it because I always included here on our resource slide. Thank you so much for Minerva for sharing those links. And we certainly hope that you will join us in our next upcoming two sessions. As I mentioned, next week, we're going to be speaking a lot about difficult situations, which include some of these difficult conversations we've alluded to, and how to approach them. But also what happens during patient-provider communication can sometimes cause difficult or tense or terse situations as well. So we're going to talk about difficult situations, difficult behaviors, how to manage them as well, and how to provide tips to your caregivers. We're also going to talk about elder abuse and reporting, and what to do during difficult situations, which is really what everyone wants, are those tips. We always like to provide resources that you can use and share as well with the clients with whom you're working. Please remember that 988 is a great mental health hotline that is free and accessible to anyone. I have provided it to a number of caregivers, especially male caregivers, who have a little more reluctance to share their feelings and who often wind up then in crisis. So it's a really great resource to share. And also 211 in your local community. Darla has asked if she can get the slides emailed to her. We will always pass a copy of those along to the Wilmette Charitable Foundation. And remember that the program is being recorded. So you can go back and we will share the website in just a moment on my next slide to review any of the information that people with whom you work. So again, all of the resources on these slides are hyperlinked when you do receive them. Anything that you see with an underline, you can just click on. And last but not least, information about the foundation and the Caregiver Teleconnection sessions that are on the YouTube channel you can find here. So I want to pass the baton over to Glenda, who has some additional information to share with you all. And if you have any last questions or comments, again, feel free to think about those, enter them in the chat.
Right, and Minerva will put up the survey momentarily, and you can just go through that as I'm telling you what's coming up on the Caregiver Teleconnection. You know about the next two sessions that are coming up in this series. But let me tell you what else we have on tap in October, which is rapidly zooming by. On Monday, October the 21st at noon Central Time, there'll be a presentation by the North Central Texas Caregiver Teleconnection regarding ombudsman, that funny word that we throw around sometimes in long-term care. They are the neutral advocates helping family caregivers navigate long-term care. And presenting that will be Chelsea Lane. So if you are anticipating placing your loved one in long-term care or have someone there already, you might want to listen in to this session about ombudsman. And then on Tuesday, October the 22nd at 11 o'clock Central Time, I'll be back with you and with Cynthia Hazel. We've had her on before. I certainly enjoy facilitating her sessions. And this is going to be talking about mastering mindful self-care. Back to that self-care again, caregivers. Need to take care of yourself so you can take care of someone else. So those are our sessions other than the ones that Lucy and Elliot are presenting this month. And then the last session is going to be a Spanish language session on Friday, October the 25th at 11 o'clock Central Time. And I'm sorry, but I can't It's about evaluating capacity for my poor Spanish skills. But anyway, we'll try and get out to you what that session is going to be about. And thank you for doing the session survey. We appreciate that too. Let's see. Minerva has also put in the chat box. This is the annual Caregiver Summit in San Antonio, and she has information there. And I think you can do this virtually as well as in person. So take a look at the Caregiver Summit coming up and see if it's something that you would like to attend either virtually or in person if you're in the San Antonio area. Okay, I'll turn it back to Lucy and Elliot for any final comments. And if you have questions, put it in the chat box, unmute your your microphone, or press *6 on your telephone to join the conversation.
Lucy, go ahead.
No, I just want to say I want to thank all of you for being with us. And I just want to remind everybody again that there are two people in this relationship, and caregivers really need to take care of yourself. And if you are a caregiver and if you're a healthcare worker, thank you for all that you do.
Absolutely. Thank you all for what you do, and thank you so much for spending time with us today. I hope that you will join us next week. Thank you.
Thank you, everyone, for taking time out of what I know is a busy day to join us for this session on the Caregiver Teleconnection. And I hope to see you next week when I'm back with Lucy and Elliot. Take care of yourselves. Self-care is so important, and we'll see you soon. Bye-bye.
Bye.